Hello to my channel. Hello and welcome to my channel today, Boo Snakes and More. Today we're going to be talking about the measles vaccine. So please like this video and subscribe to the channel. And for more videos like this, watch my other house channel, A&A Snakes and Stuff. My youngest son's channel, He Needs Toys and Games. Or my oldest son's channel, Little Christian. Now let's dive into the video. A leading U.S. health official on Sunday urged people to get incinerated against the measles at a time of outbreaks across several states, and as the United States is at high risk of losing its measles elimination status. Take the vaccine, please, said Dr. Mehmet Oz, the Centers for Medicare and Medicaid Services administrator whose boss has raised suspicion about the safety and importance of vaccines. We have a solution for our problem. Oz, a heart surgeon, defended some recently revised federal vaccine recommendations, as well as past comments from President Donald Trump and the nation's health chief, Robert F. Kennedy Jr., about the efficiency of vaccines. From Oz, there was a clear message on the measles. Not all illnesses are equally dangerous, and not all people are equally susceptible to those illnesses, he told CNN's State of the Union. But measles is one you should get your vaccine. An outbreak in South Carolina in the hundreds has surpassed the record case count in Texas 2025 outbreak. And there's also one on the Utah/Arizona border. Multiple other states have had confirmed cases this year. The outbreaks have mostly impacted children and have come as infectious disease experts warn that rising public distrust of vaccines generally may be contributing to the spread of a disease once declared eradicated by public health officials. Asked in the television interview whether people should fear the measles, Oz replied, "No, oh, for sure." He said Medicare and Medicaid will continue to cover the measles vaccine as part of the insurance programs. There will never be a barrier to Americans get access to the measles vaccine, and it is part of the care schedule, Oz said. But Oz also said, "We have advocated for measles vaccines all along, and that Kennedy has been on the very front of this." Questions about vaccines did not come up later in a Kennedy interview on Fox News channels, The Sunday Briefing, where he was asked about what kind of Super Bowl snack he might have. Probably yogurt. He also eats steak with sauerkraut in the mornings. Critics of Kennedy have argued that the House Secretary's longtime skepticism of U.S. vaccine recommendations and past sympathy for the unfunded claim that vaccines may cause autism may influence official public health guidance in ways contrary to the medical census. Oz argued that Kennedy's stance was supportive of the measles vaccine despite Kennedy's general comments about the recommended vaccine schedule. When the first outbreak happened in Texas, he said, "Get your vaccines for measles," because that's an example of an element that you should get vaccinated against, Oz said. The Republican administration last month dropped some vaccine recommendations for children, an overhaul of the traditional vaccine schedule that the Department of Health and Human Services said was in response to a request from Trump. Trump asked the agency to review how peer nations approach vaccine recommendations and consider revising U.S. guidance accordingly. States, not the federal government, have the authority to require vaccinations for school children. While federal requirements often influence those state regulations, some states have begun creating their own alliances to counter the administration's guidance on vaccines. U.S. vaccination rates have dropped, and the share of children with exemptions has reached an all-time high, according to federal data. At the same time, rates of diseases that can be protected against with vaccines such as measles and whooping cough are rising across the country. Kennedy's past anti-vaccine activism. Kennedy's past skepticism of vaccines has come under scrutiny since Trump first nominated him to lead the Department of Health and Human Services. During the Senate confirmation testimony last year, Kennedy told lawmakers that he closely scrutinized 2019 trip he took to Suriname, which came before a devastating measles outbreak, had nothing to do with vaccines. But documents obtained by The Guardian and the Associated Press undermined that testimony. Emails sent by staffers at the U.S. Embassy and the United Nations said that Kennedy sought to meet with top Suriname officials during his trip to the Pacific Island nation. Suriname officials later said Kennedy's trip bolstered the credibility of anti-vaccine activists before the measles outbreak, which sickened thousands of people and killed 83, mostly children under age 5. Mixed messaging on autism vaccines. Oz's comments mark a broader pattern among administration officials of voicing discontent and at times contradictory statements about the efficiency of vaccines amid an overhaul of U.S. public health policy. Officials have walked a fine line in criticizing past U.S. vaccine policy, often at times appearing to express sympathy for unfounded conspiracy theories from anti-vaccine activists while also not staying too far from established science. During a Senate hearing Tuesday, Jay Blanchard, the director of the National Institutes of Health, said no single vaccine causes autism, but he did not rule out the possibility that research may find some combination of vaccines could have negative health side effects. But Kennedy in Senate testimony has argued that a link between vaccines and autism has not been disproved. He has previously claimed that some components of vaccines, like the mercury-containing preservative thiazomycin, may cause childhood neurological disorders such as autism. Most vaccines for measles, mumps, and rubella do not contain thiazomycin. A federal vaccine advisory board overhauled by Kennedy last year voted to no longer recommend thiazomycin-containing vaccines. Administration public health officials often cite the need to restore trust in public health systems after the coronavirus pandemic, when vaccine policy and the general public health response to the deadly pandemic became a highly polarizing topic in American politics. Misinformation and conspiracy theories about the public health system also spread during the pandemic, and longtime anti-vaccine activist groups saw a swell in interest from the wider public. Kennedy, who for years led the anti-vaccine activist group Children's Health Defense has been criticized for ordering reviews of vaccines and public health guidelines that leading medical research groups have deemed settled science. Public health experts also criticized the president for making unfunded claims about highly politicized health issues. During a September Oval Office event, Trump insisted without evidence that Tylenol and vaccines are linked to a rise in the inconsistency of autism in the United States. Thank you for watching this video and peace out till the next one.